Man.
Hi, Ms. Smith. How are you today?
Good, how are you?
Great. Well, my name is Cameron. I'm your student nurse, and I'm going to be performing a full head-to-toe assessment, if that's okay?
Yeah.
All right. Well, before we get started here, I'm going to wash my hands. Can you tell me your full name and date of birth?
Alex Smith, July 17th.
Thank you. So first, I'm going to get started off by inspecting your scalp and looking for any infestations, lesions, abnormalities. I'm checking your hair to make sure it is healthy and there's no signs of alopecia. I'm looking at your skin here on your face and making sure there's no signs of diaphoresis. Your skin is consistent with the rest of your body. Your temperature is warm and dry. Now I'm going to inspect your eyes. I see that they are bilaterally the same and symmetrical with your face. Next, I'm going to have you look up for me. I see that your conjunctiva is pink and moist. Have you look down. See your sclera is white and moist. Now I'm going to have inspect your pupils and see how they react to light. So if you look straight forward. All right, and I'm going to check your 6 cardinal gazes. So if you can follow my pen light with your eyes. And if you look at the tip of my pen, at the wall, and then back at my pen. All right, so I see that your pupils are equally round. They react to light and they accommodate. So that is good. Next, I'm inspecting your nose. I see that it is midline with your body. Have you look up for me. Checking for any signs of a deviated septum. Making sure your mucous membranes are pink and moist. And can you sniff for me? And they flare symmetrically, so that is good. I'm going to check your patency, so I'm going to have you sniff. And again. And there's no indications of a blockage there. Now I'm inspecting your lips. I see that they are pink and moist. And there are no cracks or lesions on them. Say ah, inspect inside your mouth here. Ah. Put your tongue up, to the left, to the right. All right, I see that your uvula, your hard palate, soft palate, and tonsils are all intact with no lesions, and they're all pink and moist. Your mucous membranes and your gums are all pink and moist with no lesions, and your gums are straight, or your teeth are straight and white. So that's good. Next, I'm going to look and inspect your ear canals and make sure there's no abnormal discharge and a healthy amount of cerumen, which there is. And I'm going to palpate your pinna, checking for any masses or abnormalities and making sure there's no pain or tenderness there. Now I'm going to have you look up for me. See that your trachea is midline with your body as well as your thyroid. Going to palpate, check for any masses or abnormalities here. I'm going to auscultate your carotid artery, and I'm going to do this bilaterally. And here I'm listening for any bruit, which would indicate a stenosis or a blockage or narrowing of the blood vessel. Now I'm going to inspect your anterior thorax. I see that your skin is consistent with the rest of your body. There's no signs of diaphoresis. Your temperature is warm. Now if I can have you take a deep breath for me. Inhale, exhale. You do not use your accessory muscles to breathe, so that is good. And your chest rises and falls symmetrically. Now I'm going to auscultate your lung fields, and there are usually 8 up front, but sometimes on women you can only access 6 of those. So if you can take a deep breath for me in and out. Okay, and here I'm just listening for any wheezes, rhonchi, or crackles, which there were none. Now I'm going to talk to you about a self-breast exam. Have you ever performed one of those before?
No.
All right, well, you're going to do this in the shower laying down, because sometimes laying down you find things that you wouldn't standing up. So you're going to do this by putting your hand behind your head. I'm going to take your 3 fingers, start at your axillary, which is your armpit. You're going to work in a circular motion all the way around. You're going to be looking to find any masses or abnormalities here. And you're going to go all the way around to your nipple, lightly squeeze, and you're looking for any abnormal discharge there. So if you find either one, just let your physician know immediately, okay? All right. Now I'm going to auscultate your heart valves. And these are located between the 2nd and 5th intercostal spaces. First, I'm going to auscultate your aortic valve, which is located in the 2nd intercostal space and on the right side of your midsternal line. Then I'm going to auscultate your pulmonic valve, which is located in the second intercostal space left of the mid-sternal line. Now your Erb's point, which is located in the third intercostal space left of the mid-sternal line. And then your tricuspid valve, which is located in the fourth intercostal space left of the mid-sternal line. And then your mitral valve, which is located in the fifth intercostal space left of the mid-sternal line. And your apical pulse, which is located in the fifth intercostal space left of your mid-clavicular line. And this is your point of maximal impulse. And here I'm listening for any murmurs or dysrhythmias. Now I'm going to have you face the wall. I'm going to inspect your posterior thorax. Here I'm making sure your skin is consistent with the rest of your body. There's no signs of diaphoresis and your temperature is warm. Your spine is midline with your body and there's no abnormal curvatures, no signs of kyphosis or scoliosis. Now I'm going to auscultate your lung fields, and there are 10 back here, so I can have you take a deep breath for me in and out. And now auscultate your lung fields laterally. Take a deep breath for me in and out. There's going to be 4 on each side. And again, I'm listening for any crackles, wheezes, or rhonchi. And now I'm going to inspect your upper extremities. I see that your skin is consistent with the rest of your body. There's no signs of diaphoresis and your temperature is warm. I'm going to check your skin trigger, looking for any tinting, which would indicate dehydration. I'm going to check your capillary refill, make sure it's less than 3 seconds, and I see there is no clubbing. Next, I'm going to palpate your pulses bilaterally. So this is your brachial pulse and your radial pulse. I'm going to check your ranges of motion, and I'm going to do this bilaterally. So this is abduction, adduction, flexion, and extension. And I'm going to check your strength. So I'd have you push against my hands downwards to the side and to the side. Okay. And now if I can have you lay down for me. Excuse me. I'm going to inspect your abdomen. So I see that your belly button is midline with your body, and there are no signs of distension, and everything is symmetrical. Now I'm going to auscultate your quadrants, and I'm listening to your bowel sounds, and I'm listening for gurgling and bubbling sounds. So I'm going to start with your right lower, right upper, left upper, and left lower. And if I hear no sounds, I'm going to make sure I listen at least 5 minutes. Now I'm going to palpate each quadrant lightly, checking for any masses, pain or tenderness. And then I'm going to deeply palpate. Alright, and now I'm going to move to your lower extremities. I see that your skin is consistent with the rest of your body. There are no signs of diaphoresis. Your skin is warm. I'm going to make sure your capillary refill is less than 3 seconds and there's no signs of clubbing. I'm going to bilaterally palpate your pulses. This is your dorsalis pedis and your posterior tibial. I'm going to check your ranges of motion. So this is abduction, adduction, flexion, and extension. Do this bilaterally as well. I'm going to check your strength. Have you push against my hands, push inwards, push upwards, and then push down. Okay. And now I'm going to flex your calf muscle here and tell me if you feel any pain.
Nope.
Okay. So that is a negative Holman sign, and if you did feel pain there, that would indicate that there could be a blood clot in your lower extremities. So that's good that you didn't feel any pain there. I'm going to have you sit up for me, put your shoes back on, and we're all finished up.
Okay.
And unless you have any questions or concerns for me.
Nope.
All right. So there's your day.